Hello and welcome. Today, we'll be exploring a widely used and highly effective tool in mental health, the Patient Health Questionnaire-9, or as it's more commonly known, the PHQ-9. Recognizing the signs of mental health disorders isn't always straightforward, which is why standardized tools are so valuable. The PHQ-9 is a self-administered diagnostic tool developed in the mid-1990s by DRs Robert Spitzer, Janet Williams, Kurt Kroenke, and their colleagues. It originated from a more comprehensive instrument called the Prime EMD and was specifically designed to be the depression module. As you can see, its core function is to assess and monitor the severity of depression, making it an essential resource for healthcare professionals. The purpose of the PHQ-9 is threefold, making it a truly versatile instrument. First, it allows you to assess the initial severity of a client's depressive symptoms, providing a clear baseline. Second, it's designed to monitor that severity over time, which is crucial for tracking a client's progress and the effectiveness of treatment. Finally, it serves as an efficient screening tool to help identify individuals who may be experiencing a major depressive syndrome or another depressive disorder. One of the greatest strengths of the PHQ-9 is how simple and practical it is to administer. It can be used with individuals aged 13 and up, making it an almost universal screening instrument for both adolescents and adults. Because it's a self-administered questionnaire, clients can fill it out on their own, which is incredibly convenient. You could even send it to a client online before their session, helping you arrive more prepared. Best of all, it takes less than 5 minutes to complete, ensuring it can fit seamlessly into any clinical workflow. Let's take a closer look at the questionnaire itself. It asks the client to reflect on the last 2 weeks and consider how often they've been bothered by 9 specific problems. These 9 items directly correspond to the diagnostic criteria for depression, covering key symptoms like loss of interest, feeling down, and changes in sleep or energy levels. The client responds using a simple 4-point scale, ranging from not at all to nearly every day. After the 9 core symptom questions, there's a very important 10th item. This question asks the client to rate how difficult these problems have made it for them to function in their daily life, at work, at home, and with other people. It's crucial to understand that this question is not used to calculate the final score. Instead, it provides a valuable insight into the client's own perception of their functional impairment, which can be a key factor in deciding whether to initiate or adjust treatment. Scoring the PHQ-9 is very straightforward. We assign points to the responses for the first 9 items. 0 for not at all, up to 3 for nearly every day. This gives us a total score that can range from 0 to 27. This score then corresponds to a specific level of depression severity, from non-minimal to severe. A score of 10 or greater is often considered a yellow flag, signaling a potentially significant condition, while a score of 15 acts as a red flag, indicating that active treatment is likely warranted. Because the PHQ-9 is very sensitive to change, you can repeat it over time, even as often as every 2 weeks, to effectively monitor treatment outcomes. Beyond the total score, the PHQ-9 offers deeper diagnostic insights. Most importantly, any positive response to item 9 regarding thoughts of self-harm must be given special attention, as it indicates a potential risk and requires immediate further assessment. The questionnaire can also help you make a provisional diagnosis. To meet the criteria for major depressive syndrome, for example, the client must have experienced 5 or more symptoms for more than half the days, including either depressed mood or loss of interest. A diagnosis of other depressive syndrome requires 2 to 4 symptoms under the same conditions. Keep in mind that for these criteria, the self-harm item counts if it's present at all, regardless of frequency. A score on a questionnaire is just one piece of the puzzle. A full clinical picture requires more information. It's important to consider if the symptoms were triggered by a specific psychosocial stressor. You'll also want to know about the duration of the current disturbance and how much it's impairing the person's daily activities. Exploring a client's personal history of similar episodes, as well as any family history of similar conditions, provides critical context that informs the overall treatment strategy. Managing this entire process can be streamlined and simplified with a platform like PsyPack. You can easily initiate assessments online, sending a link directly to your client. To track progress effectively, you can set the PHQ-9 to be re-administered automatically at regular intervals. And for peace of mind, PsyPack allows you to set up email alerts, so you're immediately notified if a client endorses item 9, indicating a potential risk of self-harm. Once an assessment is complete, PsyPack does the heavy lifting for you by generating an instant interpretive report. This saves you time on scoring and allows you to focus on what matters most: your client. The report includes a color-coded graph of individual item responses, helping you quickly identify the most pressing symptoms. It also plots the total score on a severity graph, giving you an intuitive, visual representation of the results. Furthermore, the report clearly states whether the criteria for major or other depressive syndrome are met and flags any endorsement of suicidal ideation. When you administer the PHQ-9 multiple times, PsyPack truly shines by creating a progress tracking graph. This visual timeline plots the client's scores from each administration, so you don't have to compare old reports. With a single glance, you can see their trajectory over time and clearly track their response to treatment. Follow us to stay ahead with the latest in psychological assessments and tools. Thank you for your attention, and we invite you to create a free account on PsyPack.com to explore how it can enhance your practice.